So you're very welcome here today. And as Marie said, I look after the research programme here in the All Ireland Institute of Hospice and Palliative Care. And I'm going to talk to you a bit today about Voices for Care, AIIHPC's Voices for Care, and their involvement in research. So within research, I suppose the whole point of us doing the research is to improve the quality of life for people with palliative care needs, but not only for the person, but also for their families. And within the Institute, we have a palliative care research network. This is made up of 51 members currently. These are leading researchers on the island of Ireland in the area of palliative care, and they come from our partner organisations, and you will see some of the logos of those organisations that they come from. It's very much a multidisciplinary group, and it's across 9 different disciplines, including nursing, medicine, psychology, pharmacy, speech, language and hearing therapy, health economics, law, occupational therapy and physiotherapy. So I think that's the 9 there, just counting them up on my hand. And as well as the Palliative Care Research Network, we also have an Early Career Researcher Forum. This is for people who are considered in the early or the mid-career stage in palliative care research and interested in this area. And by being a member of the forum, you will get opportunity to access peer and mentor support. You can develop links with senior members, including the PCRN members, and participate in capacity building workshops and share knowledge. So we've currently 209 members, and they're from diverse backgrounds, as you can see, on the island of Ireland, and it is free to join. So I would suggest if any of you is here today, and it's lovely to see members of our Early Career Researcher Forum and also our PCRN network here this morning. But if you're not and you're very interested in palliative care research, you're very welcome to join, and the link is there. So that will be shared with you. So right down now to Voices for Care, and I'm delighted that Maureen Gilbert is a member of the panel discussion today, and Maureen is a member of our Voices for Care. And she has been very actively involved, as well as our other members, in supporting our researchers in improving the palliative care experience. So currently, there are 36 members of the group. These are volunteers, people who have decided to give of their time, people with life-limiting conditions, family carers and interested citizens. And they guide the work of the Institute, both our own work and that of our partners and the wider stakeholders in palliative care. And that's a picture that was taken at one of our events we had when we had those in-person events. And I suppose if we're looking at Voices for Care or thinking about what their involvement in research, and they have been heavily involved in research activities and projects. This is an example of a research cycle, and we could have many different cycles. But I just suppose thinking of yourselves is, when do you think Voices for Care members would be involved in research? If this was an example of a research cycle where you have the thing where you're thinking of your idea, you're in that discovery phase, you're gathering and analysing data, you're writing up and publishing your results, and you're sharing them in an impact. And it is a cycle, but we go in and out and join the cycle at different stages. So I'm just wondering if you wouldn't mind putting it into the chat function and sharing with us when you think Voices for Care members would be involved in that cycle of research. Yeah, so we've lots of different, the think and plan. A lot of them are saying think and plan from the very beginning, all stages. Yeah, think and plan. So yeah, it's interesting to see Think, plan, write and share. Okay, thank you very much. That's great, actually. Now, and which stage, this is another question for you, do you think is the most popular with our researchers to involve Voices for Care members? Yeah, there seems to be an overwhelming number of people saying the share and impact phase. Yeah. And actually, I suppose we can just look at the opportunities and activities people were involved in 2021. An awful lot were in the gather and analysis phase, as in giving guidance and advice on the instruments or tools used to gather and analyse data that's going to be involved in the research project. And they have been involved in all the different areas, but we'd say probably in the discovery, gather and analyse phase, that's probably where they have been involved heavily. And so just to give you, in 2021, we provided, there was researchers came in with 20 opportunity research activities or projects for our members to get involved in. And if you just think of that year, 2021, that went past, the Voices for Care members got involved in 17 out of the 20 opportunities. So, you know, there really is a huge level of interest and engagement. And in every opportunity, there was more than one member involved. And I suppose that's what we're delighted about having the group, that there is not just one voice, there are many voices to get that diverse experience. And if we go back to think about the different areas, and just this is an example in 2021, just to give you feedback on where people can get involved. So in the think and plan, and when I was looking at this, I was thinking, you know, you could say this is think and plan, or is it discovery? Where is it? But looking at feedback on a proposals at a very early stage, one of the ones that we did get in Voices for Care supporting is one that was put in for funding to the National Institute of Health Research, looking at palliative end care research partnership in Northern Ireland. And Dr. Peter O'Halloran from Queen's is here this morning, and he's leading out of that. And it's a really good consortium and a collaboration and looking about what potential research projects could go for funding. So that's a really good example of getting members involved. Then in the discovery phase, we have them involved in advisory groups. This is a project that the Institute is involved in with other researchers. And this is looking at the experience of people in the Republic of Ireland living in nursing homes and their families and the staff during COVID-19 and the impact on palliative care experience. If we go then further on and look at other stages, the gather and analyse stage, what I would say is we're delighted as well that our early career researcher forum members are very good at engaging with PPI as well as the PCRN. And they have different ways of doing this to support the development of services, to inform the update of the palliative care policy in the Republic of Ireland. These are just some examples that they've been involved in. They've also been involved in events looking at the end stage where research is looking at writing and publishing and trying to get the different perspectives of Voices for Care members in the type of data that's collected by government bodies in relation to end-of-life care. They've also supported the Institute of reviewing and inputting content for our PPI tab on our Palliative Hub Professional. And then share and impact. One of the great things is we have had them involved in our annual Palliative Care Network Symposium. And this has been every year we're doing this, where we have a workshop previous to the symposium where we look at the theme of the symposium, and they help to guide and inform that symposium event, and also to be a member of the panel discussion and share then the views and perspectives of the entire group of Voices for Care as somebody on the panel. So there's just a wide range of areas that people can get involved in. And I suppose it's just very important to just share it. And they're just examples that happened in 21. And then I suppose I just wanted to spend some time now just thinking about, why would you get people involved? Why do you get Voices for Care involved in research? What is the importance of it? And one of the things I saw in a paper was, you don't know what you don't know. And I thought, isn't that really smart? That, if you don't have people telling you things that you don't know, how do you know you don't know them? And I was struck by, quite recently, one of our PCRN members, who's quite an experienced researcher, telling me after they got Voices for Care involved in some of their research, saying that they could have been speaking to academics and their fellow researchers for months or years on the topic, and they would never have considered the perspective that they got when they were listening to the Voices for Care members. So that's just really interesting and something to take away, by involving people. And I think it was really interesting that people said, let's get them involved at the very start, the think and plan, and that's where people should be involved in. And I suppose it's just to know that that's not always where people we get our Voices for Care members involved in. And I think it's something we should think of a little bit more. I know I have been stretched in my own work research that I did by my supervisor which was looking at psychological and psychotherapeutic approaches for people with motor neuron disease. And it was my supervisor at the time, it was for master's research, to involve somebody who had a life-limiting neurological condition, who was receiving care from the hospice, respite care, and involved in the daycare in the hospice, and that was also a person who was previously providing psychological and psychotherapeutic support. So to get their involvement in identifying the type of questions that I could use to talk to health and social care professionals and other members of the multidisciplinary team in a hospice providing that care was key. But I remember at the time thinking, oh, that's quite difficult. How am I going to do it? The person wasn't able to speak, had to use a light writer, other means, assisted communication devices. They were quite fatigued at times. They couldn't move. I was thinking of the challenges rather than maybe as well. And another thing that really struck me was how patient I had to be to get, they're involved, and how patient they were with me. And I think that was the greatest learning. And I suppose I remember going to get ethics approval, and we had to go to a number of places, including St. Vincent's University Hospital, and going down to a kind of like a bunker with this big table with like 20 or 30 people questioning us on our proposal. And it would have been so easy to say, do you know what, we won't bother. It's for a master's, it's time limited. But we did go ahead with it. And I think it was so valuable. So I suppose I just want to say that here today, just because it's difficult doesn't mean it isn't achievable. And I think it's lovely and it's really right that we get family carers and interested citizens involved in research through Voices for Care. But I suppose that's not missing out on the person with the palliative care needs, who are at the centre of this care. If we're to provide person-centred care, and I think it is really important to get their voice and to get them involved. And I was thinking, it's like if you're trying to build a house and, you have the architect and the builder and they're designing the house and they're planning the house and wow, it's lovely. And the family might say, oh yeah, and we could do this and do that. And then you bring the person in maybe at the last minute, or you don't bring them in at all, the person who's going to actually live in the house. And you might say to them, what paint color would you like on the wall? And they say, but you know what, that's not the house I wanted at all. So just I thought it was quite a good analogy of it. And then the other thing I think is really important is to think about what you would like Voices for Care member or other PPI contributors, what you want them to contribute to. A lot of people come to us and they're thinking of, oh, I'm in the middle, and you know what, I've been told to think about PPI, or it might be easy to involve them here, or if I was getting them involved, I would do this, this and this. So I think it's good to maybe step back and not think about the method and the way you're going to do it. You know, just think about, in an ideal world, where would you like to get their voice? Where would you like them to contribute to? And really think about that. And then the other thing I think is really important to do is, you know, when you are getting people involved and are Voices for Care members, is to think about the recommendations they make. And I know that from my experience with the researchers, they really do think about the recommendations and think about what action you're taking with those recommendations. I suppose it's really important as well to feed back to members. You know, suddenly you're moving forward as a researcher or a clinician, and you're saying, okay, now I've got the feedback and now I'm going to move on. And, you know, you know, because maybe it's for a funding proposal, maybe it's to get my project finished, but to really think about how you can feed back to the Institute or the Voices for Care members directly, so we can feed back to the Voices for Care members. Because I think it's very important for people who are, you know, volunteering, giving of their time, that they can see where their impact has been. And then, so finally, I just say to you, my colleagues are going to talk about the further information that you can get, but my email address is there. And if you would like to see Voices for Care members can be involved in research, please contact myself or any members of our team.
Excellent. So, hi, yeah, my name's Lisa Brighton, and as Marie said, I'm a researcher at the Cicely Saunders Institute of Palliative Care Policy and Rehabilitation. And I guess one of the reasons I'm speaking to you today is I've helped to kind of support and develop quite a lot of our public involvement infrastructure at our institute over the last kind of 5 years or so. And then kind of alongside that, in sort of my research context, a lot of the work that I do is with people who are living with lung conditions. So a bit of context for me there. I'll hand you over to Margaret to introduce herself.
Thank you. Morning, everyone. I'm Margaret Ogden. I'm a PPI member, and I've been with Cicely Saunders for over 10 years. I got involved in Palliative because of my mother's experience at end of life. This happened way back in 2003, and thankfully things have moved on since then, and I believe they have become much better. But I was so moved by my mother's experience, I just couldn't leave it there. I knew I wanted to work in research as a fundraiser at first, and then more actively in PPI. So thank you very much for the opportunity to speak to you all today.
What we will be talking about today is introducing the kind of key principles that we've been working with and where they've come from, and Margaret's going to talk through that. And then talking about putting these principles into practice, so in terms of finding the right people, flexible approaches to involvement, and building and maintaining relationships. I've just put a little note on the slide there, just acknowledging Mary's point about abbreviations and things. So although we try our best not to use abbreviations, sometimes we do slip. So sometimes we might use the word PPI, which, you know, we mean patient and public involvement. And sometimes you might hear us talk about the CSI, which is the Cicely Saunders Institute where we work. So I'll hand over to Margaret now. Margaret, would you like to share a bit about our kind of evaluation work and where our principles come from?
Yes, thank you, Lisa. PPI evaluation is something that I've developed a specialism in over the years. And we completed an evaluation, and that would be used to update the Cicely Saunders PPI strategy. It was to be co-produced with PPI members, although those changed during the course of the evaluation, which went on for quite a long time. So my other PPI colleagues were pivotal during the early stages of the evaluation, and I got involved a little bit further down the line. The methods we used were focus groups and interviews, which were held both face-to-face and virtually. This was before COVID, so you know, a lot of people did travel to London in person, but I remember I personally couldn't do that at the time, and my participation was held virtually. And it was crucial to offer both, as some PPI members, apart from me, couldn't travel. The key principles for public involvement. One principle is building and maintaining relationships, both with other PPI members and with the researchers. Involvement can be quite light touch, or it can be more intense, with opportunities to sit on advisory groups, or even to hold a co-applicancy. Whichever, PPI is conducted in a safe environment at Cicely Saunders, with researchers offering support, which can sometimes be emotional support, given the sensitivity of issues surrounding palliative care. And the second principle is incorporating flexible approaches for PPI. And this has included a carer attending meetings with a patient who needed support, providing virtual as well as face-to-face meetings, and having a more experienced PPI member present at a meeting where there may be a lot of newcomers. And we found this to be particularly helpful in moving through the agenda of a meeting. The PAPs used to meeting in community halls and speaking to each other, but it's quite different participating in a PPI meeting. And thirdly, another principle is finding the right people. Lived experience has always been paramount at Cicely Saunders, and our membership has included patients, carers and former carers. And we encourage diversity, and our members have backgrounds from BAME, the LGBTQ community, and also people who are living in pockets of deprivation throughout the country. And our research covers palliative care, rehabilitation, and of course, end of life.
So thank you, Margaret. So having, I guess, outlined these principles that we found as a result of our evaluation work and think about where they originated from, what we wanted to share with you were some tips and some examples of how they might be put into practice. As I say, there's, we're not the experts and there's never any kind of one right way to do this, but we just want to share some of the things that we've learned along the way and found helpful in our own experience. And for me, this really resonates actually with what Mary was saying a minute ago about kind of stepping back and really thinking about why we're involving people. The first thing I guess we really need to think about before starting any public involvement activities is what is the aim of public involvement for this particular research study? There might be multiple reasons that you want to involve members of the public, and this will likely differ depending on each project. But thinking this through will help you to figure out how might be best to do this and who might be helpful to involve. So for example, you might want to ensure that your study materials are acceptable to your participants. So you might plan to recruit some people who have similar experiences to your potential participants and cost in their time to review the information sheets and the consent forms. You might also want to get some new and different interpretations of some qualitative data that you're collecting for an interview study. So you might plan to have a group meeting with some public members to review and discuss those early findings. So thinking about what you're trying to achieve with public involvement can help you shape and plan what kinds of activities will be helpful, and also think about making sure it's sufficiently planned and costed into grant applications. Now, to dive into the principles a bit more, the first of the principles we'd like to talk about is this idea of finding the right people. And this is particularly important due to the breadth of conditions and topics that palliative care can include. And there's a couple kind of really important, but also very common questions that we often get asked about this. And the first is, who are the right people to involve in my project? And primarily, this will be people who have relevant lived experience of the topic you are researching. Sometimes this might include anyone living with a particular condition, and it might include people who have or are family carers for these individuals. But sometimes you might also want them to have additional experiences, for example, experiences of a particular service or symptom or treatment that you're studying. Then beyond this first layer of experience, there might be some other things you want to consider. So the next common question we get is, should I involve brand new public members or more experienced public members? And we find that often it depends on the task, but it can be very beneficial to hear from both. For example, someone with less experience of research can provide really excellent feedback on whether you're explaining something clearly and without research jargon. Whereas it might be really helpful to have feedback from a public member with experience being on a funding panel when you're asking people to review a grant application. And then one thing I just wanted to flag, that because we often come across these discussions and when we're talking about public involvement, is this idea of people being concerned about public members becoming kind of too professional over time. And that's something that I struggle with a bit, just in the sense that we all wear multiple hats. Many of us will have personal experiences as service users or family carers, and increasing knowledge of research doesn't diminish the reality of those experiences. However, it's important to acknowledge that people with different levels of experience of research might give different responses to the sort of tasks that we're getting people involved in. And that's why knowing that context and having a mixture of people where possible can be really helpful. And then the third and final question that we're commonly asked about finding the right people is, how can I really attend to equality and diversity and inclusion within my activities? And we're not looking for public involvement members to represent the whole of the population we're working with our research. That it's not feasible. But it's important to be mindful of existing power structures and whose voices are more often excluded, and maybe trying to seek out voices who are less often heard. It's important to be flexible to people's different needs and preferences, and we'll come back to this a bit in the following principle. But alongside this, just basic things like making sure we are considering people's accessibility requirements. For example, might they need support with transport, adapted written materials, or payments so that a carer can look after their loved one while they themselves attend a meeting. And I guess importantly, as far as possible, we do encourage, offering to reimburse people for their time. And this can be an important part of recognising people's time and contribution that they are giving to our studies. As we're sharing the slide, I just popped this in here. We just inserted this list of helpful resources that's been collated by our colleague, Kat Harvey, who is our Patient Public Involvement Coordinator at the System Songs Institute. And a lot of these can be a really helpful starting point when we're thinking about equality and diversity and inclusion and involvement. But for now, I'm going to hand over to Margaret to start talking about our second principle, flexible opportunities for involvement, where she's going to give some tips and examples from her own experience.
Thank you. The first thing I want to say is that the researchers at Cicely Saunders try to plan ahead so they can give PPI members the time to review and feedback comments. Communication can be via email, telephone, virtual face-to-face, and activities offered are quite diverse. Reviewing applications, which is my kind of bread and butter, PPI. Also patient-facing documents, topic guides, which is something I love to review, academic papers, and also delivering training. And the education side of PPI was something that I hadn't really envisaged would happen. But I am so pleased it did. It's been absolutely great. There may be opportunities at every stage through the research cycle, but I always think it's more challenging at the implementation stage. And I am fortunate that I've done a lot of work for NICE, and I think that's helped me help researchers with that implementation stage. I will say as well, when Mary was talking about to gather and analyse. That's my particularly favourite stage in the cycle, because I do now love the analysis side of things. Equality of opportunity, that is so important. We endeavour to use this approach wherever possible. It isn't always possible, because sometimes work is very urgent, and then I think researchers do tend to go to someone that they know and who's going to be accessible and able to deliver. But it is important to not stick to the usual suspects, to go outside of comfort zones, and to give everybody the chance to contribute. And there are examples from individual projects, some of them which I've been personally involved in. PPI members can start to develop particular areas of interest. And just some examples of projects: one on social determinants of outcomes towards end of life, an out of hours project which has involved the Delphi process, and quite a lot of projects emerged on care homes. I think more so because of COVID, and a lot of projects around medication, sometimes involving the repurposing of drugs. And PPI can lead to specialisms. For example, my particular one on PPI evaluation, or equality and diversity. I've got a PPI colleague who's really strong on that. It's important to offer flexible means of giving input, and most people do like email. But there have been times when I've offered comments verbally. Similarly, feedback on the feedback, what we call the jargon term closing the loop, can be delivered in different ways. Sometimes a document, you said, we did, can be very effective. And I once came across a PowerPoint presentation where quotes were incorporated in little bubbles, and I thought that was a very effective way of feeding back. Training and support is always available at CSI, and it can be more generic, such as partnership working and co-production, but it can be more specialised. For example, thematic analysis, which is something that Lisa introduced me to several years ago, but it's been a tool that, though I struggled to pick up at first, it's been a useful tool, and one that I've used again and again in projects. And so, as I said before, reviewing applications, yes, that's my bread and butter, and I always try and meet deadlines. But occasionally a co-applicant position becomes available, and that's where a PPI member becomes a member of the research team and has a direct impact into decision-making and problem-solving. Branding may involve commenting on logos and storyboards. I particularly like this one on breathlessness, which now appears in the reception area at Cicely Saunders, and I always smile when I see it. Some PPI members have a particular leaning towards infographics, and for qualitative analysis, training may be needed, and then a PPI member can be actively involved in analysis of transcripts. Co-authoring academic papers can be exciting, and there is always the thrill of being cited for the first time by our peers. Teaching has been an exciting new dimension, and one that's been very rewarding. And Lisa suggested I do some teaching in core research methods. That was to MSc students who weren't particularly kind of savvy with PPI, but I think it was a very worthwhile session with them. And a higher tier of involvement, maybe appointment at the CSI executive and strategy groups. I've been chair of the strategy group for a year, and then it passed over to another colleague. But that was really good experience for me to have of chairing a multidisciplinary group that included PPI members. It was very, very interesting. And it is CSI's policy to refresh the groups regularly. And I think that's important to give everybody a chance at the opportunities. Thank you.
And then moving on to our last principle about building and maintaining relationships. And this can be particularly important due to, as we've already acknowledged, the sensitive nature of topics in palliative care. But this is a common theme across research about what makes good public involvement. People often talk about the importance of enthusiasm and creating informal spaces and welcoming spaces for our public members. I wanted to flag this particularly helpful resource from Trinity College Dublin and the Health Research Charities in Ireland about beginning public involvement relationships. When individuals were asked about what makes a good researcher-public involvement relationship, the top 3 characteristics they found were a researcher who's a good communicator, so someone who keeps in touch, a researcher who can show respect, empathy and understanding, and a researcher who has time for our public involvement contributors. And within our projects, this can be as simple as us making sure we respond in a timely way, keeping people up to date on our project, and taking time to go through questions and queries in more detail when people are unsure about something, just like we might do with our wider project team members.
And starting off, a good place to start is with the plain English summary. And it may have headings. The recommendations by AIIHPC are to have the research question, the aim of the project, design, methodology, dissemination, and PPI. And they're the headings that I usually recommend people incorporate. So by all means, use headings and bullets if it's going to aid ease of reading. Explain abbreviations, avoid jargon, and also complex phrasing. And invite PPI members to review the summary and suggest edits, but do keep within word limits. Think about what help you may need. Patients, carers, people with an interest in palliative care, and how often will you hold meetings? Think about venues when we do return to either hybrid or face-to-face meetings, because a good venue can make or break a meeting. And arrange payments according to NIHR Centre for Engagement guidelines. Consider expectations from both sides. I think that's very important. And if you endeavour to keep to commitments, that should be reciprocated. And training needs. Training's another of my passion, I've got to say. Think about using both external training. There may be some available in Marie Curie and other organisations. And I'm going to be doing a writing course in April, which is quite intense training where I'll attend every afternoon. But I need to improve my writing, that's how I feel. There may be internal training on tap in-house. And that may all be on the research cycle that we've talked about a lot already, partnership working and thematic analysis. Develop a glossary of well-used terms, and that may well help the PPI members, and update that glossary regularly. And give support and advice on payment, both online and verbal. I would say I do tend to get a lot of queries around payment, and sometimes I can answer them, sometimes I've got to go away and research them myself.
And then I guess once you've been getting people involved in your project, whether they're reviewing materials or providing their views on your findings, it's just really important to make sure and maintain a two-way communication stream. So it's not about a one-way stream of feedback from public members to us. We need to think about responding to their comments and letting them know what we have and haven't taken on board. And so we just wanted to flag this really great guidance from Elspeth Matthews' team at University of Hertfordshire, which is all about giving feedback to public members. And then the final point from me, towards the end of the project, it can become important to reflect on and even sometimes report on public involvement in your research, not only to show how it might have supported the work or made a difference, but also to share your learning about what worked well and what could be done better next time. Some journals, like the BMJ, are starting to ask studies to report on public involvement, and some research funders are increasingly asking researchers how they're going to evaluate or reflect on their public involvement activities in their research. So I just wanted to flag two helpful frameworks that I've personally used. I've used there's a checklist called the GRIP2 checklist. There's a long short form and a short form. I personally have found the short form just quite a helpful structure for thinking about and reflecting on public involvement and reporting that in projects. And then the other framework that I've also found helpful to work with in terms of reflecting and reporting is the UK National Standards for Public Involvement. There isn't currently a kind of single or standard way of doing this sort of thing, but the most important part is that we're taking time to think through, ideally alongside our public members, what worked well and what difference their involvement make and how we can do it better going forwards. I'll let Margaret wrap up with our final messages.
Yes, the final messages are around tools. Tools may be found online or internally, or you may have to go further afield to find them. And PPI members may be helpful in this. Bringing in early PPI is always advisable, but you may not be able to offer payment when it comes to pre-submission work, and that's always a bit difficult. Sometimes researchers can find a pot of money to be able to recompense PPI members. But I think PPI members are usually quite understanding if they aren't able to be paid pre-submission. I know I always think, well, you know, let's get the funding. That's the initial goal. There is no right or wrong way, and it's good to have a strategy as we have at CSI. But it's important to be very flexible too. And feedback is crucial. I feel this is how you see your PPI grow, and your project should start to develop more effectively too. So that's my take on PPI in a nutshell.